Hi everybody, and welcome to the Monday edition of the Facebook Live Online Recovery Support Group. My name is Kelly Kirk, and I'm a Certified Peer Support Specialist in Richmond County, North Carolina. So thanks for watching. Let me read our introduction really quick. It'll just take a minute. So, welcome to the Facebook Online Recovery Support Group supported by the Sandhills Opioid Response Consortium. This is a forum where people in recovery can come together. We are here to encourage and support individuals in their recovery journey by sharing our own experience, strength, and hope. Our meetings consist of daily readings, meditations, devotionals, and open discussions. We only ask that when sharing, you adhere to the rules and guidelines of this page. All recovery paths are welcome, and please feel free to share your questions or comments throughout the meeting. So again, my name is Kelly Kirk, and today I thought I would talk about medicated assisted treatment. And that is basically taking medication and going to therapy to get off of opioids. So let me read you a statistic really quick. In the United States, 8 to 10% of people 12 years of age and older, or 20 to 22 million people, are addicted to alcohol or other drugs. The abuse of tobacco, alcohol, and illicit drugs in the United States exacts more than $700 billion annually in costs related to crime, lost work productivity, and healthcare. So obviously, drugs are a huge problem. Addiction is a huge problem. So let me pose this scenario to you. So let's say I'm a smoker and I want to quit smoking. And so I go and I buy like a bunch of nicotine patches and the lozenges, however you say it, the things you suck on, and the gum. And so like I've got all this stuff that I'm taking to help me get off of cigarettes because you're trying to quit. So of course your friends and family would be like, oh man, that's so good, you're gonna quit smoking, that's great, or they might be like, oh yeah, I know somebody that chewed the gum and that really helped them get off of the cigarettes, and they would be supportive and they would be proud of you for doing what you need to do to stop. But so take that same kind of scenario and put it with opioids. What if you're trying to deal with an opioid problem or a pain pill addiction? Would your friends be as supportive of you if you wanted to take medication to help you get off? Maybe not, probably not, because there's so much stigma and kind of not so much great information out there about medicated assisted treatment, or MAT. And the bottom line, the reality is that there are a number of FDA approved evidence-based medicated assisted treatments for opioid use disorder. And these treatments support long-term recovery and significantly reduce overdose rates. But one of the problems is the traditional drug and alcohol treatment industry has been shockingly slow to support medicated assisted treatment. And even more shocking, and I'm getting some of this information like the facts and stuff from some articles I read to prepare for this, but even more shocking, many doctors in the treatment industry have not been educated about their effectiveness or trained to use them, despite comprehensive efforts such as the Surgeon General's report last year reiterating the important role of these treatments. In fact, if you seek treatment for an opioid use problem, there is a significant risk that the treatment professional you speak with will either not offer these medications or have biased opinions about them that negatively influence how you feel about being prescribed them. And as many opioid users will attest, there is a sense that you are just an addict looking for another drug if you go there and try to get medicated assisted treatment. But the cigarette quitter really would not get that same kind of, reaction from their doctor. So you've got that barrier where there's a lot of bad information and stuff about medicated assisted treatment, or you've got the people that think that you're just trading one drug for another drug. And on top of that, there's only certain doctors that can prescribe this. They have to take like a special course to be able to prescribe this, and they can only prescribe to like 100 patients or something at a time. So if you're lucky enough to find the right doctor to get these medicines, it's highly likely that if you tell your friends or family that you're taking a medication that helps you manage your addiction, they might be like, okay, but when are you really getting sober? And I think with all those obstacles and all those hoops that you've got to jump through, and then the stigma that you're going to be facing, I think that that's preventing a lot of people from trying it. And I don't really think it's the friends or family's fault. It's kind of just like this culture, and the treatment industry has, not been promoting this as a treatment. And it's actually like the gold standard. The federal government and the Surgeon General and all the top doctors in the country are promoting this, but a lot of people are against it. And this article also said over 2 million Americans are estimated to be dependent on opioids, and drug overdoses are now the leading cause of death for people under 50. That's substantial. Drug overdoses are the leading cause of death for people under 50. That means that people are dying more of drug overdoses than anything else. It says America's opioid habit is an undeniable tragedy and is one of the worst public health crises in the nation's history. And it's made all the more tragic by the fact that there are many proven treatments for this problem, yet they are not widely known or accepted. This must change if we are to stem the tide of opioid addiction in this nation and prevent more loss of life. People, and this is one that really affects me being where I'm at in North Carolina, is that people who live in rural areas have even less access to treatment. So what is MAT? Medicated assisted treatment is an evidence-based treatment for substance use disorders, including opioid use disorder. The Surgeon General's 2016 report called Facing Addiction in America says MAT is a highly effective treatment option for individuals with alcohol and opioid use disorder. Studies have repeatedly demonstrated the success of MAT at reducing illicit drug use and overdose deaths, improving retention in treatment, and reducing HIV transmission. So there's basically 3 main MAT medications. You've got methadone, buprenorphine or Suboxone, and then naltrexone. Those are the 3 main ones. From what I understand, methadone, which I have not taken, is a whole, it blocks the opioids completely in your brains, and Suboxone is a partial opioid antagonist. But they both, it's the same goal, to get you into recovery. And getting the patient to feel normal, have little to no side effects or withdrawal symptoms, and have controlled cravings is the main things that they do. And because these medications help with the cravings, they allow a person to be a reliable employee, complete their education, and generally function without the ups and downs of drug abuse. But and this is important too, MAT is not just medications. It's often misunderstood as a medication alone treatment, but MAT is to be used in combination with counseling and behavioral therapies to provide a whole patient approach to the treatment of substance use disorder. So MAT combined with therapy helps to support long-term change. So there's other newer treatments that are along those same lines, they have now something called Suboxone, and it's the first once monthly injectable buprenorphine product. So that means you would only go like once a month and get a shot, and you would be good for the whole month. There's also something called Probuphrin. It's a tiny implant inserted into the arm, and it delivers a constant low dose of buprenorphine. Let's see. And this was interesting. I wrote this down, that one doctor had said, "We live in a society that stigmatizes the evidence-based gold standard of care when it comes to opioid use disorder. Medicated assisted treatment like buprenorphine or methadone. These drugs dramatically cut death rates from an overdose. Those people who are struggling with opioid addiction get their lives back. Why does this matter? Because buprenorphine and methadone work. They save lives and increase recovery." So, but the ultimate goal of MAT is full recovery, including the ability to live a self-directed life. MAT treatments have been shown to improve patient survival, increase retention in treatment, decrease illicit opioid use and criminal activity among people with substance use disorder. It increases patients' ability to gain and maintain employment. It improves birth outcomes among women who have a substance use disorder and are pregnant. And I know that women that are pregnant get prescribed Subutex, which doesn't have that extra ingredient that Suboxone has, that opioid blocker. And they'll only let you be on that if you're pregnant. But these medications are safe, cost-effective, they reduce the risk of overdose, they increase treatment retention, improve social functioning, reduce the risk of infectious disease transmission, and reduce criminal activity. So that's basically all the technical stuff. But I have a story, my story on medicated assisted treatment, which is pretty cool. So I've been in recovery this time for almost 6 years. And my journey with MAT began probably in 2010, and it was new. It was a new thing, and I was like really bad addicted to pills, to opioids, like the unholy trinity, which is like oxycodone, Soma, and Xanax. Those 3 pills. That was my life every day, all day. And I heard about the Suboxone. So I went to a psychiatrist. It was a psychiatrist office. And they told me when I called to make the appointment, they were like, "Don't even come if you're still taking the pills. Like, wait till after you're done with your last pill." And then I went there, and I was already sick. I had withdrawal symptoms. I was like sneezing, coughing, yawning. I had chills. I was sweating. You know, and I was really sick, you know, and I went in there, and the doctor talked to me for a long time, and I thought he was going to give me the medicine, but he's like, "No, go home and come back tomorrow. I need you to be in full withdrawal." And I was like, "I am in full withdrawal," but he wasn't having it. And so I went home, and I suffered all night, and the next day, I swear I like crawled in there. I was so sick, and I was like, "Am I sick enough now?" You know, and so he gave it to me, and I can remember like crawling into the Walgreens and giving him a prescription and waiting while they filled it, and I just thought I was gonna die. Like, it was awful. But then, like, when I finally got it, like 10 minutes later after I took it, I felt like 100% better. I was like normal again. I just felt good. I mean, I wasn't high. There was no kind of altered reality. It was just, I felt just good, you know, like normal. Like, I never even took drugs ever. I felt normal, you know, but I still had that addictive personality. So like the next day I took like 8 of them, you know, because I was always taking handfuls of pills. So I figured, you know, if I take more of these, maybe I'll feel something, you know. So I took like 8 of them, and I was pissed because nothing happened, you know. But then it took me a few days to realize that one is enough, you know, and that I'm not going to get high on these, that I'm just going to feel okay, you know. And but a couple of days after that, it kind of dawned on me that on the Suboxone, I wasn't constantly obsessed with thinking about pills, because that was my life. The minute I woke up, I would be thinking about my pills and how am I going to get more pills and how many do I have left and all that. And all that went away. And I could just like focus on my kids, and I could focus on myself and my family. And I just felt normal, you know, and I just can remember like being so grateful, you know, that I felt normal. But, you know, that wasn't the end of my story. No, I had to like punish myself some more. So I ended up, well, I look back now and I know that I didn't make any real changes to my life. I just switched on to the Suboxone. I didn't change my thinking. I didn't change my behaviors. None of that. So eventually I went back on the pills. And it wasn't until like 2014 that I tried the Suboxone again. And this time, you know, I made changes. I went to my therapy. I talked to my counselor a lot. I went deep and I talked about a lot of this stuff from my childhood. I read that book that I talk about this all the time, but the book by Joyce Meyer called Battlefield of the Mind. That book was an eye-opener for me, because I realized that I didn't have to believe every thought that came into my head, and that, you know, I was being too hard on myself and I was being selfish. I know that's kind of a contradiction, but it was all negative for me. My thoughts were all negative. It was always looking at the downside and focusing on the hard part instead of focusing on the good part. And so slowly, you know, I changed, and the medication-assisted treatment stayed a part of my life. And I realized that I don't actually need 3 a day. I don't even need 2 a day. So I just take one, and I cut it up into 3 pieces, and I just take my 1 a day. And, you know, some people that I talk to about Suboxone, they're like, well, how long do I have to be on it? You know, and I'm like, there's no set time. Everybody's different. You need to talk to your doctor about your life and your needs, and don't be in a hurry to get off of it, because once you get on Suboxone, you can get your life straightened out. You can, you know, whether you need to get a job or make amends with your family or kind of make things up to your kids, get your house in order, so to speak. And then once you are in a new routine, a healthy routine, then and only then can you think about like start getting off of it. You know, it's basically like a period of time between your full-blown addiction and then not being on anything. That's your transitional help while you get getting out and make yourself and life, get your rhythm is working, mom or whatever. Then you can get off. Yeah, that was I felt so much. I wasn't changing, and I was thoughts in my sorry. I wanted to quote things to remember to treat. More is to take can't, there's no lighter. It's some in your system. Some people don't need one. Some people just need one. It's meant for cats. It's meant to insist in their system. Opioid way of life. Shooting up hair, you're popping a single day. Suboxone option or can't speak. Or it's not. Feel a different tasting it. Other thing to remember is make other changes and mix those things. They become a. It takes to make a habit. I think it takes to break a habit. As long as you for me, like for about I'm starting to feel like I will be ready off of it. It's just that my journey has been I don't I need that as like my buff now get that I but I mean the goal is to be in every things are different. If you are in a program, then recover abstinence. That's not one say, other medicated treatment. And remember, is government record the government. What it's like record for opioid order. Or rumors about treatment. Now, would you rather the person go over to meet your standard of what recovery, or would you medication that's a safe, that not getting they dose? It's to have nothing in faith. The next thing to remember is the idea you're gonna have counseling if you're the treatment. Face that, make them, be on you, talk deep that brought in the first place. Because if you don't know underlying issues, and you're all Suboxone, all that stuff's back up. So you got to trauma and the way that you handle anxiety and you think of your outlook and do you on things, or do you focus on things in life that you about what I have. I'm being really grateful you have, because I'm grateful for what keeps my that helps me to become gratitude. You need to start thinking on, she's so cool. I'm hey, with my family, I have that I'm one. That's a way to do that thing. Anyway, if you do get on treatment and you feel more of it, talk about things. And if you're weaker, me, like I would go like 20 times. So I'm always like looking for something fake, on the computer, I would have went in Sandhills. Now I can my box and pieces, get a little piece and send it out. So I call that weaker. You can take your same dose, split it up, that you're taking more often, but take opioids if you're on. Some people get death. That other there that it's a block and deterrent. I'm medicated program and you're on, you know, you know that has that going to be sick. Take that pill. If you don't have, then you're taking it. It's like a way to hold accountable. If you insurance, card, save me. I was the cheapest if you don't have insurance, and so there's way cheaper than one. If you don't have insurance, $200 to go to the doctor. And oh, that's so. Add all that. Did you spend? I mean, you're spending more than you got it. It's just so. Say it's a good if you don't have a lot of people. One is not opioid system. Not they feel something. I hear this a lot. That people boxing into the people are getting high. Is it a bad? But you got to remember people that are already on. So if you somebody sitting at a board and their girl puts a box to envelope and opioids something, you know, for people having an disorder. So sayings or myths, not a drug for another. No, you're not. You're not. Abstinence is a way to recover. There are many ways, and everyone should, everybody else is recovering. I mean, you to be living a positive life where you're not substances, you're growing, learning, and changing the time for Suboxone medication. You've got people selling for money. People go to the doctor and claim they're on opioid and they get and then they well they're selling it to the people that are out using drugs that get drugs. What they do is buy a Suboxone somebody to get sick because the Suboxone takes away the symptoms like that. So if you heroin use and drug doesn't have heroin and you Suboxone here over heroin, a lot of people are taking it when they have opioid use, taking it and using it. Is that the crutch, tool, and I was saying before, die because they feel for being on it. So the thing, there are support groups that do welcome people on medication. All of them. So I've lived in North Carolina, I've been to many meetings and meetings in all Lauderdale, St. Lucie, Beach, big one, all of them, and every group is different. Vibe is different. NA is A, and just that group. I mean, but if not a group near you that welcomes us, might be not that group that's on that. You tell anybody they're important that you're getting support. But I'll just end saying that there needs to done to get doctors licensed of it. If you've got many people dying and you need to tend or over addicted to drugs, there needs to be available treatment options, especially areas, you know. They are doing more. I have several courses online. You can Suboxone online. They require your counseling. They have like a group day or Thursday, and you have to fund it. You give them the money, they send it to your house. So they are more ways to help, you know, rural communities and people that might be home. I can tell you from personal that it works. It works. You know, keep fighting, and that all are valid. It doesn't matter as long as that human on their day and gets their life for themselves and their family. So that's what I have for today.